Hello student, now we are going to discuss principles of gas diffusion at the level of lung. So all of us know that diffusion of gases, that is the oxygen and carbon dioxide, occurs at the level of lung by process of simple diffusion, right? So simple diffusion is the process by which exchange of gases occur at the level of lung. Then the next thing is that in which zone of the lung exchange of gases occurs. We all know that there are conducting zone and there are respiratory zone or exchange zone. So if you look at the exchange zone, that is the area where exchange of gases occur. According to Guyton, this exchange zone components are also known as the respiratory unit of lung. So respiratory unit of the lung means that part of the lung, that unit of the lung where the exchange of gases are occurring, exchange of gases is occurring, right? So it consists of three structures, right? That is respiratory bronchioles will be there, then alveolar duct will also be there, and I told you all these zones, they contain small alveolar buddings, and because of this alveolar buds they can take part in gas exchange, and obviously the last division is nothing but the alveoli, right? So if I ask you respiratory unit, it consists of what are the different parts or what are the different segment. Number one, you will say that this is respiratory bronchioles, right? Could you recall the Oebel's classification division number? Respiratory bronchiole is division number 17, 18 and 19. Okay, then second level of structure is alveolar duct, right? So could you recall the segment? This is 20, 21 and 22, right? And the last division, obviously that is nothing but alveoli, and that is the division number 23rd. So the respiratory unit is consist of all these different segment where exchange of gases is occurring, right? Now if I look at that exchange of gases when it is occurring, what are the intervening layer through which the gases is passing through? Then that layer, that membrane is known as the respiratory membrane. So second concept is respiratory membrane concept, right? So look at, we all know that if you look at the level of alveolus, right, so it is lined by type 1 and type 2 pneumocyte, but exchange of gases occurs only through type 1 pneumocyte because they are very thin and flat cells, right? So this is, suppose that this is type 1 pneumocyte, and in between obviously type 2 pneumocyte will be there, but we are not interested here because type 2 pneumocyte is not helpful for exchange of gases because of the thick cytoplasm. Anyway, so the inner lining of the alveoli, you also know that there will be a very thin layer of water, okay? Although it is not looking like very thin, but there will be a very thin layer of water in the inner lining which also contains surfactant, right? So if the oxygen is traveling through, okay, this layer, okay, so oxygen, suppose the oxygen is transported from alveoli to capillary. So what are the layer? First it has to cross this water layer, right? Then it has to cross this type 1 pneumocyte and its basement membrane. Then it will get this interstitial tissue of the lung. So this is the very thin interstitial tissue of the lung, and then after crossing the interstitial tissue of the lung, it will encounter the endothelium cell of the capillary. So this is the capillary, pulmonary capillary with their endothelium cell. So oxygen also has to cross through this endothelium cell, and then it will reach at the level of blood. So if I write down all these layer, right, so first one is the water layer, very thin layer of water, along with the surfactant molecule which are present inside this water layer, right? Then second layer is nothing but type 1 pneumocyte cell, plus the basement membrane of this type 1 pneumocyte cell. Then third is the interstitial tissue of lung, right, tissue of lung, right? And then it will encounter the endothelium cell and its basement membrane. So although you are finding out that respiratory membrane consists of multiple layer, okay, but if you look at the thickness of this whole respiratory membrane is very thin, and that is on an average 0.6 0.6 micrometer. Guyton is saying in some part the thickness is only 0.2 micrometer, but on an average the whole thickness of this respiratory membrane is 0.6 micrometer. Obviously you require a very thin membrane, otherwise the exchange of gases by process of simple diffusion is not going to happen, right? So we have to remember this respiratory unit and respiratory membrane concept. The next concept is that diffusion capacity of the lung, right? Next concept is the diffusion capacity of the lung. Diffusion capacity of the lung. So what is the process by which diffusion of gases occurring at the level of lung? Simple diffusion. And simple diffusions follow which law? All of you remember from general physiology concept that simple diffusion rate is calculated by this law, and that is known as Fick's law of simple diffusion. So same way, if you want to calculate, if you want to assess the diffusion capacity of the lung, you have to follow this Fick's law of diffusion. And if you look at here, diffusion capacity of the lung, that is DL, is equal to, I am writing this Fick's law in a little modified version, that is delta P multiplied by A multiplied by K upon D, right? So now if you look at here, DL is the total diffusion capacity of the lung. It depends on this factor. What are those? Delta P, that is the partial pressure difference between two compartments, or you can say the partial pressure difference between this alveoli and this capillary blood, right? That is the delta P, partial pressure difference. Then A is the total surface area of diffusion. A stands for area, and this K is a constant, right? And this D is the diffusion distance or the thickness of the membrane. So now we are going to look at individual parameter, all of these individual parameter, and how they are going to change my diffusion. Although this is very simple, but some important point you have to remember here. So first of all, delta P. So if I ask you what is delta P, you will say that delta P is the difference of partial pressure between alveoli and capillary blood. Now if I ask you what is the delta P for oxygen diffusion, right? Average delta P, partial pressure difference for diffusion of oxygen at the level of respiratory membrane. Your answer will be delta P for oxygen is 11 millimeter of mercury on an average. Very important. You must be thinking that 11, where from you are saying that so, right? So look at here. If I ask you what is the partial pressure of oxygen at the level of alveoli, from your basic knowledge it is 100. What is the partial pressure of oxygen which is coming through this venous blood? That is 40 millimeter of mercury. So if I ask you what is the difference of partial pressure of oxygen between alveoli and capillary blood, the venous blood, obviously 100 minus 40, so it will be 60. But what I have told here, that this is not the average one. Okay, I will explain that why it is 11, but for the timing you remember that average partial pressure difference for oxygen is 11 millimeter of mercury, clearly given in Guyton. And if I ask you what is the partial pressure difference for carbon dioxide transport, so carbon dioxide transport, venous blood carbon dioxide partial pressure is 46, alveolar partial pressure carbon dioxide is 40, so difference is 6, but I am asking you average partial pressure difference. You will understand the meaning a little later. For the timing you remember only this value, that is 1 millimeter of mercury is the average partial pressure difference for carbon dioxide transport at the level of lung, right? So that is delta P. Now you look at the second factor, that is A for area, that is the total surface area of diffusion. Could you recall what I told you? What is the average surface area for diffusion? The average surface area for diffusion in a normal lung, considering that all 300 to 500 millions of alveoli are working, the average surface area is 70 meter square according to Guyton, but on an average 50 to 100 meter square. 50 to 100 meter square, thinking of that, it's a very big room. The surface, the floor of a very big room is around 70 meters square. And if you look at the blood, right? So if you look at this total surface area of diffusion at the level of lung, it is 70 meters square. And how much blood is entering in the pulmonary circulation? How much amount of blood is there in the pulmonary capillary? Could you recall? That is only 2% of the cardiac output. So 2% of cardiac output means approximately 100 ml blood is present at the level of capillary. So you can understand that this 100 ml blood is distributed in 70 meter square surface area. That means how strongly the diffusion of gases is going to happen. Very large area, but very thin amount of blood is spread through the whole surface area. So easily the gas will be transported at the level of lung. But you have to remember that this surface area of diffusion can be increased, right? So this A, surface area of diffusion, it can be increased. So when the surface area of diffusion will be increased, if there is hyperinflation of the lung, hyperinflation of the lung, like for example in case of acute asthma attack, in case of acute asthma, there is a little hyperinflation of the lung, and that's why you know that there will be increase in diffusion capacity whenever there is increase in surface area. And because of this, I discussed in the previous session that diffusion capacity of the lung, it is little increased in case of asthma, particularly due to hyperinflation. And this diffusion area or surface area of diffusion can be decreased, right? So this diffusion area will be decreased in case of rupture of alveoli. Like for example, the disease condition is, suppose there is emphysema, right? So some of the alveoli will get rupture due to expansion and air trapping phenomena, you all know, okay? So in case of emphysema, in case of pulmonary resection, right? Suppose there is surgery and there is resection of some part of the lung, then also the diffusion capacity will be decreased. And obviously in case of old age lung, due to destruction of some of the alveoli, the diffusion capacity of lung will also decrease, right? So this is about A, right? So we have discussed so far here the delta P, how it is affecting the diffusion capacity, then surface area A, how it is affecting, then I will discuss K, but before K I am discussing this D. So I told you D means, small d is nothing but diffusion distance, which is nothing but thickness of the respiratory membrane. It is nothing but thickness of the respiratory membrane. So on an average, normally this is 0.6 micrometer, but this thickness can be increased in certain disease condition. It can be increased due to certain disease condition, right? So if the thickness is increasing, what will happen? The D is in the denominator. So if the thickness is increased, then obviously the diffusion capacity of the lung will be decreased, and it is seen in case of lung fibrosis. So there will be deposition of the fibrous tissue at the level of lung interstitial tissue, or there can be pulmonary edema. So water molecule is deposited at the level of lung interstitial tissue. In all of this condition, the diffusion distance increases, and because of the increase in diffusion distance, the diffusion capacity of the lung will be reduced, right? So now after discussing this D, now I am coming to this K. I told you that K is nothing but a constant. This constant depends on solubility of the gas upon your molecular weight, root over of the molecular weight. So solubility upon your molecular weight. Okay. So this is a constant. This constant is known as the diffusion coefficient. Okay, diffusion coefficient. Okay, this is known as diffusion coefficient of gases, right? So K is known as constant. It is diffusion coefficient of the gases. So it depends on two things. One is solubility and second is the molecular weight, right? So this constant has a value. We assume that the K for oxygen is equal to 1. Right, we assume this, that suppose the diffusion constant, diffusion coefficient for oxygen is 1. So what will happen to the diffusion coefficient of carbon dioxide is 20.3 times than that of the oxygen. So oxygen is 1, carbon dioxide is 20 times more than that of the oxygen. And if you look at the carbon monoxide, then it is 0.81 times of that of the oxygen, right? So carbon dioxide diffusion coefficient is almost 20 times more than that of the oxygen. Means which gas will be diffused faster at the level of respiratory membrane? The carbon dioxide. How much faster? 20 times faster than that of the oxygen. So if I maintain a same partial pressure difference between alveoli and capillary for oxygen and for carbon dioxide, for the same partial pressure difference, the carbon dioxide transport is 20 times higher, faster than that of oxygen. Right? That means if you keep all other parameter constant, this K is 20 times more for carbon dioxide than oxygen. What is the utility? What is the applied aspect of this? Suppose I am saying that this patient is suffering from lung fibrosis, so there is increase in diffusion distance D, so there will be less diffusion of oxygen, right, to the level of blood. So the person is going to suffer from hypoxia, suppose. Now, what about carbon dioxide? Carbon dioxide will also get this kind of difficulty because the fibrous tissue is there. But do you think the carbon dioxide is going to face the same kind of difficulty like that of the oxygen? Answer is no, because carbon dioxide diffusion is 20 times faster than that of the oxygen because of the K, because of the diffusion coefficient. So carbon dioxide will easily able to transport from blood to alveoli and from alveoli to outside body. So if the person is suffering from hypoxia, do you think he is going to suffer from hypercapnia also? Answer is no, because carbon dioxide diffusion is faster. That's why it is written in books that in case of respiratory diseases, hypoxia is more common. Hypoxia is more common symptoms than that of hypercapnia. Getting my point? Hypercapnia, right? Because carbon dioxide diffusion is most faster, right? More faster than oxygen. So that's why patient may suffer from hypoxia, but hypercapnia may not be present, because if the problem is at the level of diffusion distance, then carbon dioxide transport will not be that much problematic. But when the carbon dioxide can accumulate in your body, when the hypercapnia will also be associated with hypoxia, if there is obstruction here, okay, or suppose you are not able to expel this carbon dioxide from the lung, okay, your respiratory muscles are paralysis, right? Your ventilatory center is paralysis. You are not able to wash out this carbon dioxide from alveoli. Then the blood carbon dioxide will go on rising gradually. Or suppose there is a tumor, there is a foreign body which is obstructing the bronchioles, then you are not able to wash out the carbon dioxide from alveoli. In that cases also hypercapnia can develop. Otherwise the hypercapnia is very less common than that of the hypoxia, right? So this is about the K. What is the importance of K? Now we also have to remember that depending on this K, the mathematical question can be given that if you change this K or constant, then your diffusion capacity will change. Look at the MCQ first, okay? Then we'll understand. So this is the MCQ here. It is a GIPMAR MCQ. So if gas X is 4 times as soluble and 4 times as dense than gas Y, then what is the ratio of diffusion rate between X and Y? So just now we have seen that the diffusion capacity of the lung depends on this delta P, A multiplied by this K, that K is S upon root over of molecular weight, and obviously your diffusion distance is also there. That means if all other parameters are constant, then also diffusion capacity is inversely directly proportionate to S and inversely proportionate to molecular weight. So now if you put all this parameter X upon Y, so X is how much times of Y, that I am calculating. So S, that is 4 times soluble, so I am writing here S, that is 4 times soluble, and 4 times dense means molecular weight is 4 times than that of the gas Y. So I can easily calculate that this is 4 upon 2, that will be 2 times. That's why I can easily answer here that answer is going to be D, that what is the ratio of diffusion rate between X is to Y. So X will be 2 times more diffusion 2 times more diffusion than that of the Y. So this way question can be given based on this diffusion constant or K, right? So I hope all of you are going to remember these 3 numbers. That is, if the diffusion coefficient for oxygen is 1, it is 20 is for carbon dioxide, and that is 0.81 for carbon monoxide, right? Now if I ask you that oxygen diffusion is how much times faster than carbon monoxide diffusion? Why I am saying so? Because I will tell you later. So I am asking that oxygen diffusion is how much faster than carbon monoxide diffusion with respect to carbon monoxide. Then what you have to do? 1 upon this 0.81, so it will be approximate 1.23 times, right? So remember this value, we will apply this value a little later. So oxygen diffusion is 1.23 times than that of the carbon monoxide diffusion, right? Now the next concept is diffusion equilibrium, right? So next topic is diffusion equilibrium, right? Okay, so to understand this topic, I am going to draw one schematic diagram. So this is an alveolus, right? And I have to also draw a pulmonary capillary. So this is a pulmonary capillary. Look at this diagram first, okay? So this is the venous blood coming, this is the actual capillary region, and this is the pulmonary vein region, right? Blood is going out of this, blood is coming here, right? So venous blood, I hope you remember that the partial pressure of oxygen here is 40 millimeter of mercury, and the partial pressure of oxygen at the level of alveoli is 100. And also you have to remember that this is the starting point of capillary and this is the ending point of capillary, right? So this is the portion of pulmonary capillary. Now we think of, suppose one RBC is just entering at the level of this pulmonary capillary here. So this is a RBC. It is just entering in the pulmonary capillary. Suppose that is 0 time, right? That is 0 time. How much time this RBC will take to travel this whole pulmonary capillary and it will exit through the other end of the pulmonary capillary? How much time is required? Suppose that is T. So if I measure the time difference between this 0 to T, this is the total times where RBC is passing through this pulmonary capillary, or I can say that RBC is spending this much of time at the level of pulmonary capillary, right? This time is known as the transit time. This time is known as the transit time at the level of pulmonary capillary, and this is 0.75 second. Getting my point? So please remember, whenever the blood is entering at the level of pulmonary capillary, it will take 0.75 seconds to cross this pulmonary capillary. So the total time that the blood is spending at the level of pulmonary capillary is 0.75 second, right? Obviously, if your heart rate is faster, okay, your spending time, this transit time will be decreased. There is no problem, but on an average heart rate, considering on an average heart rate, the transit time is 0.75 second. Okay, now, so whenever oxygen is diffused from this alveoli to the level of this pulmonary capillary, now you have to imagine a very important condition. So the oxygen partial pressure at the venous blood is 40 and the partial pressure of oxygen at the level of alveoli is 100. So what is the difference of partial pressure? 60. So the oxygen will be transported easily from alveoli to capillary. If the oxygen is transporting, then what will happen to the partial pressure of this pulmonary capillary blood? Okay, what will happen to the oxygen partial pressure at the pulmonary capillary blood? Gradually it will increase. So suppose that is rising to 50, then 60, then 70, then 80, then 90. It will continue like this until and unless there is an equilibrium. Getting my point? So whenever more and more oxygen is transported at the level of capillary, the capillary blood partial pressure of oxygen will rise. I am asking, that the equilibrium of pressure between alveoli and this capillary blood will be reached at which point through this pulmonary capillary journey. It will be done at the end of the pulmonary capillary or at the beginning of the pulmonary capillary. That is my question. Or in respect to time, if I ask you how much time it require for diffusion equilibrium for oxygen to occur. Remember, this diffusion equilibrium will reach when the RBC has traveled only 1/3 of this pulmonary capillary. Only 1/3 of this pulmonary capillary, then and then only the partial pressure of the pulmonary capillary will be 100 millimeter of mercury. That means if I ask you that the diffusion equilibrium for oxygen is requiring how much time? 0.25 second only. That is a 1/3 of the total transit time is required for the diffusion equilibrium of oxygen to occur. For carbon dioxide also the same amount of time, that is 0.25 second is required. So you have to remember this information for your future MCQ, that within the first 1/3 portion of the pulmonary capillary the diffusion equilibrium is reached. That means I can understand that the remaining 2/3 of this pulmonary capillary there is no diffusion of gases at all. Getting my point? So diffusion is occurring only on the first 1/3 half of this pulmonary capillary, and then the diffusion pressure is becoming equal with alveolus and pulmonary capillary. Whenever the partial pressure is equal between these two regions, then we can understand that diffusion is not going to happen. That means remaining 2/3 zone of this pulmonary capillary means there is absolutely no diffusion of oxygen at all. Before that, the diffusion equilibrium has already reached. Getting my point? So that means even if your heart rate is higher, even if your blood is running faster through this pulmonary capillary, there will be no problem in the diffusion of oxygen as well as diffusion of carbon dioxide, because there is a buffer zone, there is a safety zone, that this remaining 2/3 portion, okay, even if your blood is running at a faster rate here, then also the oxygen and carbon dioxide diffusion will get adequate time for complete diffusion to occur. So this is known as a safety factor for this diffusion, right? So you also have to remember this. Now you just came to understand that diffusion equilibrium is reaching within first 1/3 of the pulmonary capillary. That means in the remaining part, if I ask you what is the difference of partial pressure between alveoli and pulmonary capillary blood, then the partial pressure difference is 0. So if I ask you what is the average partial pressure difference between this alveoli and this pulmonary capillary blood, are you going to say that is 60? Answer is no. 60 difference will only be present at the beginning part of this diffusion, but more and more diffusion means there will be decrease in diffusion gap. That means if I have to calculate a average partial pressure difference for oxygen, then I have to take the integration from 0 to t time point p dt, and this is nothing but 11 millimeter of mercury. Getting my point? Same way if you calculate for carbon dioxide, okay, same way if you calculate for carbon dioxide p dt, then it is only 1 millimeter of mercury. So this is for oxygen and this is for carbon dioxide. Getting my point? That's why I told you earlier that the diffusion, okay, partial pressure difference for diffusion for oxygen it is 11, and for carbon dioxide this is 1. That is the average partial pressure difference considering this phenomena, right? Now if I plot this phenomena on a graph, okay, so always the graphical representation is very easy, okay, because understanding is very clear in graph. Okay, so if I graphically represent this phenomena for this carbon dioxide diffusion and oxygen diffusion, so how it will look like, right? So x-axis, obviously it will be the time axis, and y-axis it will be the partial pressure. Okay, so y-axis will be the partial pressure, right? Pressure or partial pressure I'm writing here. So we are thinking of oxygen, but before that you look at the time axis. So this is 0.25, this is 0.5 second, and this is 0.75 seconds. So I hope you got it. What is this? So this is the whole transit time I am drawing on the y-axis, and I am trying to understand that during this transit time how the oxygen diffusion equilibrium is reaching, right? So I told you earlier that the venous blood that is entering at the level of pulmonary capillary, what is the partial pressure of that oxygen? 40. So suppose that is 40, and after equilibrium what will be the final pressure? That is 100 millimeter of mercury, because that is the partial pressure at the level of alveoli. So now if I plot this curve, that how the partial pressure of oxygen will rise, I can easily understand that this diffusion equilibrium will be reaching at 20 that is 0.25 second, right? So this is the point where the diffusion equilibrium is reaching, because if you drop a perpendicular, the time that is required is only 0.25, and after that what will happen? After that no further increase in partial pressure of oxygen is possible, because diffusion is stopped. So now you look at that in case of oxygen diffusion curve, okay, you are getting a plateau. Okay, so partial pressure of oxygen is rising from 40 to 100 millimeter of mercury. It is taking only 0.25 seconds at the level of pulmonary capillary, and then remaining 0.5 second there is no increase in partial pressure of oxygen, right? Because there is no diffusion. So this is typical of oxygen diffusion curve. Similarly, if you plot the diffusion equilibrium curve for any other inert gases, inert gas means the gas which is not going to react with your hemoglobin, that is known as the inert gas. Why inert gas I am talking about? Because if the gas is reacting with the hemoglobin, then that is a chemical reaction. Chemical reaction means partial pressure will not rise. Partial pressure is only given by the dissolved portion of the gas, right? So when the oxygen is entering in your blood, right, the most of the oxygen they will react with the hemoglobin, and little amount of oxygen will remain for the dissolve, and that's why initially the partial pressure of oxygen is rising gradually, because most of the oxygen is combining with the hemoglobin. But if you are giving nitrous oxide inhalation at the level of alveoli, right, so what is the venous blood nitrous oxide concentration? That is 0, because now you are giving inhalation of the nitrous oxide gases. So the venous blood nitrous oxide concentration is 0. Whenever the nitrous oxide is inhaled, it will enter in your pulmonary capillary, and all the gas will remain in the dissolved condition, because it is not going to react with the hemoglobin, because it is an inert gas. So what will happen? The nitrous oxide gas will follow a different curve where the equilibrium will be more faster. Look at this curve. The nitrous oxide equilibrium is reaching at a more faster rate than that of the oxygen also, because there is no nitrous oxide which is combining with hemoglobin in chemical form, and that's why you will be finding out a similar kind of curve but more faster than that of the oxygen also, and this is typically for nitrous oxide. That means I can understand that for this oxygen and for this nitrous oxide, the diffusion is very adequate. The diffusion is at its best. Diffusion at its best, the diffusion is occurring within 1/10 of the time period of the transit time, okay, and it is occurring of 1/3 of the transit time in case of oxygen. Nitrous oxide diffusion equilibrium is only 1/10 of the total transit time, and oxygen, I told you repeatedly, that is 1/3 of the total transit time. So diffusion is occurring at its best. Can I increase the diffusion by increasing the diffusion capacity? Answer is no. You cannot increase the diffusion, because diffusion is occurring at its best. So how can you increase the diffusion? By changing which parameter? If you increase the blood flow, then what will happen? So more and more blood flow mean more fresh blood is going to enter. So the blood which is already saturated, already in equilibrium with that of this oxygen, right, that blood is not going to take further fresh oxygen, right? But if I give fresh blood inside this pulmonary capillary, then the fresh blood is going to take more oxygen. So only way by which you can increase this diffusion of nitrous oxide and oxygen is by changing the blood flow, or by changing the perfusion of the lung. More and more new blood is coming means that can take the oxygen. Otherwise, these two gases, they are following a condition where the diffusion is occurring at its best. That's why the limiting factor for the diffusion of these two gases is not the diffusion capacity, it is the perfusion, it is the flow. By changing the flow, by changing the perfusion, you can increase the diffusion. That's why these two gases are known as perfusion limited gases. So this is known as perfusion limited or flow limited gases, right? Okay, so nitrous oxide and oxygen, not only nitrous oxide and oxygen, even the carbon dioxide, it follow this kind of perfusion limited or flow limited gas. But think of a condition. Suppose one person is suffering from hypoxia. Okay, suppose one person is suffering from lung fibrosis. In that cases, what will happen? Because there is fibrous tissue at the level of this respiratory membranes, the diffusion distance will be more. If the diffusion distance is more, then the equilibrium of this oxygen partial pressure may not reach even at the end of the pulmonary capillary. Then the oxygen diffusion will follow a different kind of kinetics where the curve will look like this. So the curve will look like this, that the person is suffering from hypoxia. So this is also oxygen diffusion, but oxygen diffusion in case of hypoxia, this is indicating that the diffusion equilibrium of oxygen is not reaching even at the end of this pulmonary capillary. Getting my point? So this kind of phenomena is very prominently seen, this hypoxia, oxygen diffusion in hypoxic condition, this kind of phenomena is very prominently seen in case of another gas, and that is carbon monoxide. So carbon monoxide, what is the special property of the carbon monoxide? We all know that it combines with hemoglobin, and that is 250 times faster combination in respect to oxygen. So it has very high affinity for hemoglobin, and if it is attaching with hemoglobin, then that is a chemical bound form. Is it going to rise the partial pressure of carbon monoxide in the blood? Answer is no, because partial pressure is given only by the dissolved portion of the gas. So if carbon monoxide is combining with only and only hemoglobin, then what will happen to the partial pressure of carbon monoxide in the capillary blood? Will be very less, near equal to 0. That's why if you plot the carbon monoxide diffusion curve in the same x-axis and y-axis, then it will be like this. Okay, then it will be like this. So carbon monoxide diffusion will follow a pattern like this, where I can find out that even at the end of the pulmonary capillary, the diffusion equilibrium, forget about diffusion equilibrium, the partial pressure is not rising at all. Very little rise of partial pressure of carbon dioxide. That means, do you think the carbon monoxide diffusion is occurring at its best? Answer is no. There is enough scope. The diffusion capacity will be increased by simply increasing the more gases diffusion to the capillary blood. That means in case of carbon monoxide, if I give more fresh blood, that is not going to take more amount of carbon monoxide, because carbon monoxide partial pressure difference is still present even at the end of the pulmonary capillary. So there is enough scope that you can simply increase more amount of gas diffusion from alveoli to the capillary blood. That means perfusion is not the limiting factor here. The diffusion, there is enough scopes for diffusion. That's why diffusion is the limiting factor, or diffusion is the limiting step here. That's why this is known as diffusion limited gas, right? So if I ask you, diffusion limited gas is carbon monoxide. Think of oxygen. Oxygen is perfusion limited gas, I already told you. But if I think of oxygen in hypoxic condition, then it is following the same pattern like that of the carbon monoxide. So that's why it is said oxygen in hypoxic condition also, this is also diffusion limited gas. Getting my point? So please remember, only these two, carbon monoxide and the oxygen in hypoxic condition, oxygen in abnormal condition, these are the two gas exchange which are following the diffusion limited pattern. All other gases, including this oxygen in normal condition, the nitrous oxide, the carbon dioxide, all these gases, they follow perfusion limited pattern or flow limited pattern. You increase the flow, more amount of gas transport will occur, okay. And for carbon monoxide, you increase the diffusion, more amount of carbon monoxide will go to the level of capillary blood. This is the concept of diffusion limited and perfusion limited gases, right. Now because of this kind of property of carbon monoxide, you know that carbon monoxide is used for measuring the total diffusion capacity of the lung. So hold on. So far I told you that the diffusion capacity of the lung depends on many factors, partial pressure difference, right? Okay, your thickness of the membrane, your K, that is the diffusion coefficient, anything. But suppose I want to measure the diffusion capacity of the lung from a patient, from a subject, you know, that clinically that is done. So how the diffusion capacity of the lung is measured? Okay, we use the carbon monoxide gas for measuring the diffusion capacity of the lung. That's why carbon monoxide is known as the index gas for measuring the diffusion capacity of lung. For measuring diffusion capacity of lung, right? Diffusion capacity of lungs. So how it is done, that we are going to discuss, right? So carbon monoxide is a very poisonous gas, right? So whenever you are using carbon monoxide, you have to be cautious, okay. And you will get that why it is very poisonous or dangerous gas. You will understand this phenomena in hypoxia chapter. So for the time being, I want to measure the diffusion capacity of the lung. So what is the unit of diffusion capacity of the lung? If I say what is the unit, your unit will be ml per minute per millimeter of mercury. This is the unit for diffusion capacity of the lung. That is how much volume of gas is transporting from alveoli to capillary or capillary to alveoli in 1 minute when the partial pressure difference between these two zones, that is the capillary and alveoli, is 1 millimeter of mercury. Getting my point? That is the meaning of diffusion capacity of the lung. So if I have to measure the diffusion capacity of the lung, then what I have to do? I have to calculate that this dl is equal to, okay, total amount of gas, that is the amount of gas that is absorbed by the lung upon your partial pressure difference, okay. That is the partial pressure at the level of alveoli minus partial pressure at the level of pulmonary capillary or arterial blood. So amount of gas that is absorbed by the lung in 1 minute upon your partial pressure at the level of alveoli minus partial pressure at the level of arterial blood, right. That is the very same thing which is done, which should be done for diffusion measuring the diffusion capacity of the lung. But I cannot use oxygen directly for this purpose, because measuring the partial pressure of oxygen at the level of this pulmonary capillary or arterial blood is very difficult, because you have just seen that the partial pressure of oxygen is constantly changing. If this is the entry point and if this is the exit point, then measuring the partial pressure of oxygen at the level of this pulmonary capillary is very difficult, because that is constantly changing. So I cannot use oxygen directly for measuring this diffusion capacity. But what is the property of carbon monoxide? Just now we have seen that if this is the alveoli, right, and if this is the pulmonary capillary, then whenever carbon monoxide is transported from this alveoli to the level of pulmonary capillary, what will happen to the partial pressure of carbon monoxide at the level of this capillary blood? That is near equal to 0. Just now I told you that if there is huge amount of carbon monoxide diffusion, then the partial pressure of carbon monoxide will rise a little bit. But if I give a very little percentage of carbon monoxide, then the partial pressure of carbon monoxide at the level of capillary blood, that is the pulmonary capillary blood or the arterial blood, that will be near equal to 0. That means this difference of partial pressure between alveoli and arterial blood, you don't have to measure for carbon monoxide, because if you measure only the partial pressure of carbon monoxide at the level of alveoli, we know that PCO at the level of alveoli, so I should write down like this, PaCO, partial pressure of carbon monoxide at the level of alveoli, minus P arterial blood carbon monoxide partial pressure will be equal to PaCO only. Partial pressure of alveoli is equal to this difference, because at the level of capillary blood the partial pressure of carbon monoxide is 0. So now what is remaining? I have to measure that how much amount of carbon monoxide is absorbed at the level of lung. So how can you measure that? That is measured by a method which is known as single breath carbon monoxide inhalation method. Single breath carbon monoxide inhalation method, right? Single breath carbon monoxide inhalation method. So what is done in these cases? A gas mixture is used which contain only 0.3 percentage of carbon monoxide, and remaining will be little bit of helium, and then oxygen will be there. So this gas mixture is used for measuring the diffusion capacity of the lung. Oxygen means the normal air will be there. Now whenever the person is taking this gas mixture inhalation, right, then carbon monoxide will be delivered at the level of this alveoli. Okay, I can easily calculate what is the partial pressure of carbon monoxide at the level of alveoli because I know this fraction. Okay, so that is only 0.3 percentage, right? So I can easily measure this PaCO, right? Then after inhalation, okay, the gas, okay, the person will exhale. In the exhale air also I am going to measure what is the carbon monoxide percentage. Okay, so inhalation minus exhalation, what you are going to get? You are going to get the amount of carbon monoxide that is absorbed at the level of lung, that we can easily also calculate, right? So this way, whenever you use this carbon monoxide inhalation, you measure what is the concentration of carbon monoxide in inhalation gas, and then you measure the carbon monoxide in the expiratory gas. By subtracting this, you are going to get how much amount of carbon monoxide that is absorbed by lung. So if I put, okay, so DLCO, diffusion capacity of the lung, with respect to carbon monoxide is equal to amount of carbon monoxide taken by the lung in 1 minute upon your partial pressure of carbon monoxide at the level of alveoli. Now you look at the formula become very simplified, and in this manner if you calculate the carbon monoxide diffusion capacity, then it is 17 ml, right, per minute per millimeter of mercury pressure. So this is the normal diffusion of carbon monoxide in lung. In 1 minute, 17 ml carbon monoxide will be absorbed from lung to the level of blood if the partial pressure difference is maintained equal to 1 millimeter of mercury. So now I have to calculate the oxygen diffusion capacity, DLO2, diffusion capacity of oxygen at the level of lung. So with respect to carbon monoxide, I told you earlier, oxygen diffusion coefficient is how much time faster. I told you already that if the oxygen diffusion coefficient is 1, then carbon monoxide diffusion coefficient of the lung is 0.81. So with respect to carbon monoxide, if I want to understand oxygen diffusion is how much time faster, then it is 1.23 times faster than that of the carbon monoxide diffusion capacity. So if I multiply this will be ml per minute per millimeter of mercury. Getting my point? So this way you can calculate the diffusion capacity of oxygen at the level of lung is approximately 21 ml per minute per millimeter of mercury. Getting my point? And if I want to remove this millimeter of mercury, that means if I maintain a 1 millimeter mercury pressure difference between alveoli and capillary, then this much amount of oxygen will be transported. So what is the average partial pressure difference between alveoli and pulmonary capillary? Then that is 11. So if I ask you total amount of oxygen diffusion at the level of lung in 1 minute, it will be equal to 21 multiplied by 11, okay, ml per minute. Getting my point? So it will be approximately 230 ml. So that is the total amount of oxygen diffusion in 1 minute at the level of lung, right? Same way, if you look at the diffusion capacity of carbon dioxide, DLCO2, what will you do? We know the diffusion capacity of carbon dioxide is 20 times faster than that of oxygen. So just simply multiply this 21 ml into 20 times. This will be the diffusion capacity of carbon dioxide at the level of lung whenever you maintain a partial pressure difference of 1 millimeter of mercury. But the same way, if I calculate the total carbon dioxide diffusion at the level of lung in 1 minute, it will remain same to same, that is 21 multiplied by 20, because the average partial pressure difference for carbon dioxide transport is only 1 millimeter of mercury. Getting my point? So this way you remember the total will remain same for the carbon dioxide because the average partial pressure difference is 1, but total for oxygen will be different because the average partial pressure difference is 11 millimeter of mercury. I hope you get this thing right. So these are the all principles of diffusion at the level of lung for various gases. Now the next topic, okay, which is related to this diffusion only, that alveolar gas equation. So now next we are going to discuss alveolar gas equation. Okay, how to calculate the partial pressure of oxygen at the level of alveolar, by which equation, that is alveolar gas equation. So before discussing alveolar gas equation, if I ask you that at the level of atmosphere, what is the total partial pressure of gases? That is 760, that is known as the barometric pressure. So at the level of atmospheric air, ATM air, atmospheric air, the total pressure, that is the barometric pressure, is 760 millimeter of mercury at sea level, right? Then we also know that if you look at the composition of this atmospheric air, then nitrogen is 79%, that is the maximum. Okay, so air is composed of mainly nitrogen, that is 79%. Oxygen, all of you know this thing, that is 21%, and carbon dioxide is very little, that is 0.04%. So what is the meaning of this percentage? It is very simple, that if you collect 100 ml of atmospheric air, 100 ml, within that 100 ml, 79 ml is the nitrogen, 21 ml is the oxygen, and only 0.04 ml is the carbon dioxide. Now this total pressure of this gas mixture, what is the gas mixture? These are the gases. So Dalton's law is saying that total pressure is equal to the partial pressure of the composition gases or component gases. So this is the Dalton's law. The total pressure, that is the barometric pressure, will be equal to the partial pressure of the component gases, that is nitrogen, oxygen, carbon dioxide mainly. Other gases you can ignore, they are very little percentage. So if I ask you, calculate the partial pressure of these gases individually, that will be very, very simple. So partial pressure of nitrogen, I can understand that total pressure, within that total pressure 79% will be the partial pressure of nitrogen. So 760 multiplied by 79 upon 100, that will be the partial pressure of nitrogen in atmosphere, and it will be approximately 600 millimeter of mercury. Getting my point? So maximum pressure of the barometric pressure is mainly due to nitrogen. Partial pressure of oxygen will be same way, 760 multiplied by 21 upon 100, so it will be approximately 160, 159, but 160 I am putting a round figure. So this is an MCQ which has already been asked in JIPMER examination, so please be careful. If the question is what is the partial pressure of oxygen at the level of atmosphere, your answer is 160 millimeter of mercury, not the 100. 100 is at the level of alveoli. Okay, I'll show you how to reach at that level. So partial pressure of carbon dioxide will be how much? 760 multiplied by 0.04 upon your 100, so it will be 0.3 millimeter of mercury only. That's why we say that the total pressure is 760 millimeter of mercury, that is the barometric pressure. Within this total pressure, maximum pressure is exerted by nitrogen followed by oxygen, right? Now when you ascend into high altitude condition, okay, we'll be reading this high altitude in a separate topic, but for the timing you remember that whenever you ascend to a high altitude region, which parameter will change? The barometric pressure will change, or the composition is going to change, or the partial pressure is going to change. Remember, composition of this air, it remains fixed irrespective of your altitude, right? So even if you reach at the level of Mount Everest, okay, and you say, sir, I have taken 100 ml of pure air from Mount Everest, even if I analyze that air also, I am going to get 79 ml of nitrogen and 21 ml of oxygen only, right? Means composition will remain same, but this barometric pressure will decrease, right? Composition will remain same, but because this barometric pressure is dropping, what will happen to partial pressure? The partial pressure is calculated based on this barometric pressure or total pressure only. So if the total pressure is decreased, then the partial pressure of all gases, they are also going to be reduced. That's why there will be reduction in partial pressure of oxygen, and that will produce hypoxia at the level of high altitude. Not only that, there will be reduction in the partial pressure of nitrogen, there will be reduction in the partial pressure of carbon dioxide also, means all gas partial pressure will be reduced, right? Now, after understanding this phenomena at the level of atmosphere, now you look at, suppose that you have inhaled certain amount of gas into your lung. So we all know that whenever you inhale certain amount of gas, the gas has to pass through the conducting zone where exchange of gas is not going to happen. Then what is the role of this conducting zone? So what is happening at the level of conducting zone of my lung, right? So inspiratory gas means the gas which has already entered inside your lung, right? We are going to discuss that. So this is the conducting zone of the lung, and this is the alveolus, means this is the exchange zone of the lung, right? So schematic diagram, this is the conducting zone of the lung. So you know that conducting zone means it is a dead air, exchange is not going to happen. Then what role the conducting zone is playing in our lung? Very, very important role. Two roles. Number one, it is going to change the temperature of the inhaled air, temperature change, right? And second, it is going to causes humidification of the atmospheric air. Getting my point? So suppose you are inhaling certain amount of air, and that is a dry air, So what is going to happen? There will be evaporation of certain amount of water from the surface of this bronchial and bronchial region, that is the terminal bronchioles and the bronchus. Evaporation of certain amount of water means water vapor, and that water vapor will be added up at the level of this air, at the level of this conducting zone. So addition of water vapor or water molecule, that is nothing but moisturization of the air or humidification of the atmospheric air. That is one of the important thing, because dry air means the resistance will be very, very high, frictional resistance. Second thing, the change of temperature. Suppose the air that you are inhaling, that has a temperature of 4 degrees centigrade, outside is very cold, and you are inhaling cold air inside your lung. Cold is a stimulus for, release of acetylcholine, and if there is release of acetylcholine at the level of bronchi and bronchiole, smooth muscle contraction will happen, and that will leads to bronchospasm, right? Okay, so what you have to do, you have to take some precaution so that this cold air is not entering in the inner portion of your lung, and that increase in temperature from this 4 degrees centigrade to the core body temperature of 37 degrees centigrade is also done at the level of this conducting zone. That's why we say that conducting zone is like that of the air conditioner of our lung, AC, air conditioner. It is doing humidification of the air, as well as it is also changing the temperature of the air, right? And it is preventing the unwanted bronchospasm, right? So now we got to know that humidification is occurring, water molecule is added up in the gas which is entering in your lung. So this is known as the inspiratory gas. But problem is that whenever one extra gas is added in the air which is coming in your lung, what will happen? The formula of this Dalton's law, that is PB, total pressure, it will remain same. because it is in continuation with that of your atmosphere. So if the atmospheric pressure is 760, the same pressure is at the level of conducting zone. So barometric pressure, atmospheric pressure, total pressure is not going to change. But now the total pressure will be equal to the Pn2, PO2, PCO2 plus a new gas that has been added up, that is PH2, water vapor, right? Means now you can imagine like this. Previously, one room was shared by 3 friends, oxygen, nitrogen, carbon dioxide. Now in that room, in the same room, another person is added. So now the 4th person is sharing the same room. So what will happen to the area of all of this friend, all of this person? There will be little decrease in partial pressure, there will be little decrease in area of all of this. So that's why I can understand that whenever the air is entering at the level of this conducting zone, there will be drop of partial pressure of oxygen. What was the partial pressure of oxygen which was entering at the level of your lung from atmosphere? That was 160 millimeter of mercury. At the level of conducting zone, if I want to calculate the partial pressure of oxygen, I can do like this. Okay, I can do like this, that PO2, okay, is equal to PB minus pH2. I am subtracting this water vapor pressure from the total pressure and assuming that the percentage or the concentration of the oxygen is not changing. So I am multiplying this with 21 upon 100, getting my point. So assuming that the total pressure minus water vapor pressure, so the percentage of the oxygen is not changing, but the total pressure is changing. So that way I am changing this and I am using this formula. So this way, if I calculate the partial pressure of oxygen, so I have to put the normal value of all this thing. So PB is the 760, PH2, remember this value, PH2 is 47 millimeter of mercury, multiplied by 21 percentage is the percentage of oxygen. So it will be approximately 149. I am writing 150 millimeter of mercury, but it will be 149. So this partial pressure of oxygen which we are calculating at the level of conducting zone, this oxygen partial pressure is known as partial pressure of oxygen in the inspiratory gas, Pi, small I or capital I, whatever. PiO2 is the partial pressure of oxygen of the inspiratory gases. Inspiratory gases means the gas which has already entered at the level of your conducting zone. So at the level of atmosphere 160, at the level of conducting zone, that is the inspiratory air, that is 150. Please remember, this has also been asked in MCQ. This is known as inspiratory air oxygen partial pressure, right? That is 150 millimeter of mercury. So there is drop of 10 millimeter mercury pressure, right? Now, when this inspiratory air is further entering at the level of alveoli, that is P capital AO2, partial pressure of oxygen at the level of alveoli, there will be further drop of partial pressure of oxygen. Why? Because we all know that from the level of alveoli there will be continuously absorption of oxygen at the level of pulmonary capillary blood, right? Pulmonary capillary blood. So I can easily understand that P capital AO2 will be whatever oxygen is coming in your inspiratory air, that is PiO2 minus oxygen consumption or oxygen absorption at the level of lung, oxygen consumption at the level of lung. I can write down like this. So now I have to calculate the oxygen consumption at the level of lung. You can do this by direct spirometry method, or sometimes we use this oxygen consumption indirectly with this RQ ratio. RQ, that is the respiratory quotient or respiratory exchange ratio, respiratory exchange ratio or respiratory quotient. We all know this is equal to the carbon dioxide production, okay, carbon dioxide production, right, upon your oxygen consumption, right, oxygen consumption. And for an average balanced diet, we know that this RQ or the respiratory exchange ratio, normally this is 0.8, right? So from this ratio, if I calculate oxygen consumption is equal to, so I can easily understand that this is nothing but carbon dioxide production upon your RQ. Now the carbon dioxide production which is happening in your body, that is going to decide how much will be the partial pressure of carbon dioxide at the level of alveoli. That's why it is also written PaCO2 upon RQ. Getting my point? So in steady state condition, whatever carbon dioxide is produced, that is going to reach at the level of your alveoli, and that will determine what will be the partial pressure of carbon dioxide at alveoli. So that's why this is the oxygen consumption, PaCO2 upon RQ. So now if I replace here, so the equation will be like this: PiO2, that is the partial pressure of oxygen in the inspiratory gas, upon your PaCO2 upon your RQ, right? Okay, minus this. Okay, so now PiO2, if I replace this PiO2, how we have calculated this PiO2? Look at here, the PiO2 is calculated by this equation, that is Pb minus PH2O multiplied by percentage of oxygen or fraction of oxygen, right? So if I write down this whole equation now, P capital AO2 is equal to Pb minus PH2O, right, multiplied by FiO2 minus PaCO2 upon your RQ. This is the whole equation that you have to remember, by which directly you can calculate the partial pressure of oxygen at the level of alveoli. So what you require? You require Pb, that is the barometric pressure. Okay, you require the partial pressure of water, that is 47, and I told you that is a fixed value. If your body temperature is not changing, then the PH2O will remain constant, and that is 47 millimeter of mercury. So whenever your core body temperature is 37 degrees centigrade, the partial pressure of water vapor is 47. So if I put all this normal parameter here, 760, okay, PH2O is 47 at 37 degrees centigrade temperature. FiO2, so this I stands for inspiration. Okay, F is the fraction of oxygen in the inspiratory air, fraction of oxygen in the inspiratory air. This is nothing but 21%. I am making this thing complicated, okay, because scientists always makes thing complicated, right? So that is FiO2 is 21%. 21% means 21 upon 100. If I ask you that percentage of oxygen or fraction of oxygen in the inspiratory air is 21%, what is the fraction of oxygen in the expiratory air? Your answer is 16%. That's why there is an MCQ that if you give mouth to mouth breathing, mouth to mouth respiration, how much oxygen is delivered to the person? Okay, so whenever you are giving mouth to mouth expiration, your expiratory air is the inspiratory air for the other person, right? So how much oxygen will be delivered? And that is 16 ml or 16%. That is the PeO2, right? And FiO2, okay, that is the FeCO2, and what is the FiO2? FiO2 is 21%. So now if I put all of this parameter normally, so I have to write down this PaCO2, that is the normal partial pressure of carbon dioxide at the level of alveoli is 40 and RQ is 0.8. Now close the bracket. So if you do this thing, then you are going to get that it is approximately 100 millimeter of mercury. That's why we say that the partial pressure of oxygen at the level of alveoli is 100 millimeter of mercury. What is the equation that we have to remember? We have to remember this whole equation. Please note down that this is a very important equation. Nowadays they are giving question based on mathematical formula. Okay, so please remember this formula by which you can calculate partial pressure of oxygen directly at the level of alveoli. So bottom line is that the partial pressure of oxygen at the level of atmosphere, it is 160. At the level of inspiratory air, how much that is? I told you that is 150 or 149. At the level of alveoli, it is dropping further to 100 millimeter of mercury, right? Further dropping to 100 millimeter of mercury. Drop, right? Now we'll go to another level, okay, where there will be further drop, but before that we will look at one MCQ. Okay, so calculate the P capital AO2. P capital AO2 means this is the alveolar oxygen in a patient receiving pure oxygen at 4 atmospheric pressure. That is a hyperbaric oxygen therapy is given. I hope you know hyperbaric oxygen therapy. Hyperbaric means when the oxygen is delivered with high pressure. What will happen? High pressure oxygen means it will be generating free radicals of oxygen, and that is damaging for certain organs. Like for example, this hyperbaric oxygen therapy is given for certain diseases like gas gangrene. Okay, the Clostridia, they cannot survive in high oxygen concentration. That's why if you give this hyperbaric oxygen therapy, the oxygen free radical will destroy that. Not only that, the hyperbaric oxygen therapy is also given for carbon monoxide poisoning, even for osteomyelitis patient, right? So this way you have to remember that hyperbaric oxygen therapy is given sometimes. So if you have to calculate the partial pressure of oxygen at the level of alveoli during this hyperbaric oxygen therapy, so simply I am going to use this formula, that PaO2 is equal to, I am writing, why I am writing, because I want you to revise it. Okay, so FiO2 minus P capital A CO2 upon your RQ, right? So now I am putting here. So what is changing? Pure oxygen, and the oxygen pressure that is given here is a 4 atmosphere. So what I am going to do, normal barometric pressure is 760, 4 atmospheric pressure is given, so multiplied by 4 minus pH2, it will remain same, it is not going to change. Then FiO2 normally it is 21%, but here it is pure oxygen, mean 100% oxygen. 100% oxygen means it is 100 upon 100. Why I am writing this? Because you have to remember like this only. Okay, later on you should remember this, that these are the thing that I am changing here. Then minus, you should write down the normal partial pressure of carbon dioxide in the alveoli, that is 40, and if it is nothing is given, then you take RQ as 0.8. But all of you know that if it is pure carbohydrate food, then it is 1, right? So you have to keep in mind that. So now if you calculate all this thing, it will be approximately 2990 as far as I remember. So this will be the approximate value, but you can calculate separately. Okay, and so you can understand that the answer that is going to be here is answer number D, that is approximately 3000 millimeter of mercury. Please believe me, this question has already been given in AIIMS entrance examination, but they have not asked you that calculate the partial pressure at the level of alveoli. They ask you calculate what will happen to the dissolved oxygen concentration in this patient, dissolve oxygen in arterial blood in this person, in this patient. Okay, so how to calculate that we will be discussing in the next chapter, that is the oxygen transport chapter. But before that, you understand the remaining phenomena, right? So what we have discussed so far, that how to calculate the partial pressure of oxygen at the level of alveoli by this formula, right? Now, so far we came to know that partial pressure of oxygen at the level of alveoli is 100 again and again. Okay, so that you should not forget. So here it is 160, here it is 150, and at the level of alveoli it is 100. Previously we have seen that when this oxygen is transported from this alveoli to the level of this capillary blood, what will happen? There will be a diffusion equilibrium. That means capillary blood partial pressure of oxygen will be also 100 millimeter of mercury, and that will reach rapidly. This equilibrium will reach rapidly. So now this capillary blood is going to go at the level of pulmonary vein, and from the pulmonary vein it will reach at the level of your left heart, and from the left heart it will go to your systemic circulation, right? Systemic circulation. But if you measure the partial pressure of oxygen at the level of systemic arterial blood, then you will get the partial pressure of oxygen here is further drop. So PO2, but here I am using P small aO2, it will be approximately 95 to 98 millimeter of mercury. Now question is, why there is further drop? Because the partial pressure of oxygen at the level of pulmonary capillary is 100, and this blood is going at the level of pulmonary vein and from there into the systemic circulation. Then why it is drop again? You know that at the end of this pulmonary capillary, what was I am using, the word that I am using here is at the end of the pulmonary capillary, there is drainage of one vein, and that vein is bronchial vein. You know that bronchial vein is draining at the level of pulmonary capillary, ending of the pulmonary capillary. It is a venous blood. Venous blood means it is the deoxygenated blood. It should drain at the level of venous side, but it is not. It is draining at the level of pure oxygenated blood. That means I can understand that this bronchial vein, which contain typically venous blood, okay, this venous blood is mixing at the level of pure oxygenated blood, that is at the end of pulmonary capillary. Means this bronchial vein is acting like a shunt. This is an absolute physiological phenomenon, because you know that lung contain dual blood supply. There is one pulmonary, okay, arterial blood which is entering at the level of alveoli, and there is bronchial arterial blood. Bronchial artery is typically supplying the conducting zone of the lung, right? And this pulmonary artery, it is going for exchange at the level of exchange zone of the lung. So lung has this dual blood supply, bronchial artery and pulmonary artery, right? So obviously the pulmonary artery, the blood flow will be very huge, because most of the blood is going for the oxygenation. And how much percentage of the cardiac output? 98% of the cardiac output is delivered at the level of pulmonary arterial blood, that is going for the level of exchange. Only 2% of the total cardiac output is passing or going at the level of bronchial artery, and from there onto the level of bronchial vein, and that bronchial venous blood is draining at the level of pulmonary capillary end. So there is mixing of this venous and arterial blood here at the level of pulmonary capillary, and it is forming a pulmonary shunt, physiological shunt. But very little, only 2% of blood is shunted here, because of which this partial pressure of the capillary blood will reduce a little, and that little reduction is nothing but from 100 to 95 to 98 millimeter of mercury. So if I ask you why there is further dropping of partial pressure at the level of arterial blood, that is due to physiological shunt, okay, that is due to physiological shunt at the level of pulmonary capillary. So look at this diagram from book, okay. So this physiological shunt diagram, I hope I have kept it here. Yes, so this is the physiological shunt, okay. So first you look at here, pulmonary artery, okay. So pulmonary artery, high flow system, 98% of the cardiac output is going through there. So this is the venous blood. Look at the color. So venous blood is going at the level of this alveoli, okay. So whenever it is going at the level of this alveoli, there will be exchange, and then it is becoming the pulmonary vein. So pulmonary vein is the pure oxygenated blood. So this is the pulmonary vein. Now you look at the bronchial artery. So bronchial artery, it is the oxygenated blood, but it is supplying oxygen at the level of this conducting zone, and then it is forming the bronchial vein. Look at here, this bronchial vein, okay. Now this bronchial vein is draining at the level of this pulmonary vein, which is purely oxygenated. Bronchial vein is draining at the end of this pulmonary capillary. So what is happening? It is forming a shunt, and this shunt is only 2% of the total cardiac output. That is known as a physiological shunt in every lung, right? Because of which the partial pressure of oxygen is dropping further at the level of arterial blood. So we have seen that oxygen partial pressure is dropping from atmosphere to the level of arterial blood. From the arterial blood, even at the level of tissue level, oxygen partial pressure decreases in a step-by-step fashion. So look at this phenomena is known as oxygen cascade, right? So the partial pressure of oxygen at the level of dry air, that is 160 millimeter of mercury. Then partial pressure of oxygen at the level of humidified air, that is 150 millimeter of mercury. There is one step drop, okay. Then further dropping of oxygen partial pressure is happening, that is at the level of alveolar gas, and that is 100 millimeter of mercury, 100 to 104 in some books, okay. And there is a little drop at the level of arterial blood, as you can find out here. Arterial blood drop is little, that is 95 to 98 millimeter of mercury, right? And then if you look at the level of tissue, so when this oxygen is delivered at the level of tissue, the tissue oxygen partial pressure, so this is the arterial blood which is bringing oxygen, and this is the tissue. The tissue oxygen partial pressure has to be lower than that of this capillary blood oxygen partial pressure. So tissue partial pressure of oxygen on an average is 23 millimeter of mercury. It can be 5 to 40, the range is 5 to 40 millimeter of mercury according to Guyton, but on an average the tissue partial pressure of oxygen, as you can find out here, this is near equal to 5 millimeter of mercury. So it can be from 5 to 40, on an average I have to remember 23 millimeter of mercury. But you remember, the tissue can survive the oxygen partial pressure even as low as 1 to 3 millimeter of mercury only, right? So although the tissue partial pressure of oxygen is 5, you may be thinking that how the tissue will survive. The tissue require only 1 to 3 millimeter of mercury partial pressure of oxygen for their normal survival. So there is again a further drop of partial pressure of oxygen at the level of tissue, and then when you are going to the level of venous blood, the venous blood partial pressure of oxygen will be little higher, that is 40 millimeter of mercury. Don't think that the partial pressure of oxygen is rising. No. This is at the level of tissue, and the blood, it is going from this arterial side to the venous side. The venous side pressure is 40, the arterial side pressure is 98, and at the level of tissue it is 23. So this is the phenomena you have to remember, which is known as oxygen cascade phenomena, right? So what you are going to remember? You must have to remember this number and the formula: 160, 150, 100, 98, then 23 at the level of tissue, and 40 at the level of venous blood. Now we are going to conclude this session with one MCQ, and that MCQ is regarding this shunt fraction calculation. So earlier we have seen that there is a shunt. So if I ask you calculate how much fraction of blood is going through the shunt, can you calculate that? What is the formula? Okay, first you look at this MCQ. So it's some difficult MCQ. So there is right to left shunt, okay, and oxygen content is given in different region, that is arterial blood and venous blood oxygen content is given 18 and 14, and the oxygen content of the pulmonary capillary blood is given 20. You have to calculate what is the percentage of shunting of the cardiac output in this phenomena. Physiological shunt is only 2%, but here is a pathological shunt, right? To understand this, you have to look at the shunt fraction calculation formula. Look carefully, very important. So this is the representation of the alveoli, as you can find out here. So this is the representation of the alveoli, right? Now, okay, this is the venous blood reaching at the level of alveoli, right? What is the total volume of venous blood is reaching at the level of alveoli? The whole cardiac output. Although 2% is going to the level of bronchial artery, forget about that. Approximate whole cardiac output is reaching at the level of lung, right? So that volume of blood is QT. So QT is the total volume of blood, or you can say that QT is equal to the cardiac output of the person, that is the total volume of blood. Then, because there is a pathological shunt here, what is happening? Although the total cardiac output is entering at the level of lung, some blood is delivered at the level of alveoli. There will be exchange of gases at the level of this blood, but some portion of the blood is going away from this alveoli, and this is nothing but your shunt fraction. So the blood which is going away from alveoli, that is not going to get any oxygen from alveoli, and that is the meaning of shunting, bypassing the alveolar exchange, right? So suppose I am assuming that the shunt portion of blood is QS. So QS is the shunt portion, QS is the shunt amount of blood, X volume of blood, that is QS, right? QS. So what is the volume of blood that is passing through this exchange zone? That will be total volume, that is QT minus QS. Simple, right? So that is the volume of blood which is passing through the exchange. Now, if you able to measure that what is the partial pressure of oxygen in this blood which is going for exchange, you are measuring the oxygen concentration, that is CCO2. C is the concentration, O2 is the oxygen concentration, and the small c is the pulmonary capillary blood. Okay, so I should write down that this is C stands for pulmonary capillary oxygen concentration. And what will happen to the oxygen concentration at this shunt portion? The shunt portion is not getting any oxygen from alveoli. So the oxygen tension will remain same to same like that of the venous blood, because ultimately this venous blood is shunting through this portion. So the oxygen tension at the shunt portion will be, that is the CVO2, that is the oxygen concentration of the venous blood. Getting my point? So if the oxygen concentration of the venous blood is CVO2, right, then the CVO2 will be the oxygen concentration of the shunted blood also, right? Then we know, okay, that ultimately this two blood is going to meet at the other end of the pulmonary capillary, and then again the whole cardiac output will be delivered at the level of systemic circulation, that is the QT. So suppose I find out what is the partial pressure of oxygen at the level of arterial blood, that is the final oxygen concentration after mixing of these two blood. So this Ca, okay, O2 is the arterial blood oxygen concentration, right? So after understanding this, I can easily say like this: the total oxygen, if I calculate from here, that is QT multiplied by CaO2, right? QT multiplied by CaO2 will be equal to, okay, oxygen which is coming from this exchange and oxygen which is coming from this shunted blood. So oxygen which is coming from this exchange is QT minus QS, it is the volume of blood, and the concentration of oxygen here CCO2, plus the shunted blood portion is QS, and the concentration of oxygen here is CVO2, that is the venous blood concentration. So I can easily write down this formula by analyzing this situation, and then after permutation combination, okay, whenever you rearrange this, okay, equation, it will be converted into this QS upon QT. QS is the shunted blood upon QT is the total blood, is CCO2, that is the pulmonary capillary concentration, minus CaO2, arterial blood oxygen concentration, upon CCO2, again pulmonary capillary concentration, minus CVO2. This is the formula by which I can calculate that how much percentage of this QT is delivered as a percentage of shunt. Okay, so I can calculate easily this shunt fraction. So if I write down this, okay, so here I am writing the same equation, QS upon QT, okay, CCO2 minus CaO2 upon CCO2 minus CVO2. Very simple, right? And then I am writing CCO2 pulmonary capillary, that is 20, minus C arterial blood, that is 18, then CCO2 is 20, minus venous blood, that is 14. So 20 minus 18, that is 2 upon 6, that is 1/3. So I can say like this, that shunt portion here is 1/3 of the total cardiac output. 1/3 means 33%, and clearly the answer will be this one. So this way you have to remember the shunt equation, so that if the question is given in your exam, you can easily calculate using this formula. Ultimately you have to remember this formula even if you don't understand. I hope you understood this, but even if you don't understand, you have to remember this formula. So this is all about principles of gas exchange at the level of lung.